Hello and welcome to We Work Together, a podcast about people working in partnership to improve health and care across West Yorkshire. In this series, we're showcasing the West Yorkshire Staff Mental Health and Wellbeing Hub and hearing from people across our partnership. In this episode, consultant clinical psychologist Dr. Nigel Wainwright speaks with Project Manager for Capacity and Transformation at Skills for Care, Juliet Green, and Mark Fry-Jones, a Registered Manager at Recovery Hub, East Leeds.
So we're here today to record a podcast. My name is Nigel Wainwright and I'm here on behalf of the West Yorkshire and Harrogate Healthcare Partnership. We're here with Juliet Green and Mark Fry-Jones to talk about the impact that the pandemic and the current situation is having on staff and volunteers who are working in care homes, domiciliary care and the social care sector. Juliet, if I can just start with you really, I guess I'm just really interested in what your observations are about what's going on in the sector right now, how people are doing and what you're noticing, what you're hearing.
We already know that stress and burnout are tangible issues for adult social care, can result in mental and physical exhaustion and that impact on the quality of care provided. And these immense challenges of the pandemic, it's impacted on an already strained workforce. And firstly, I just wanted to acknowledge the many pressures on managers right now, and the crisis is far from over. Managers are facing immense staffing, recruitment and retention challenges, struggling to fill shifts, delivering those care packages, but then trying to find time to look after themselves, connecting with their networks and their usual sources of support are more difficult. And with that stress and distress that this causes, we frequently hear the concerns about managers are resigning from their posts, they're breaking down, understandably struggling to cope in these extraordinary circumstances, and particularly as we head towards the winter and the added pressure that this brings. So to be able to share the message of support that is available through the Wellbeing Hub is a great opportunity.
Absolutely. This was already a workforce that was under incredible amounts of pressure even before the pandemic hit. And now through the pandemic and facing the prospect of a really difficult winter really makes sense that people are going to be really struggling right now. Mark, I'm just wondering, like hearing what Juliet's just said there, how that resonates with you really, what you're noticing, how you're experiencing the current situation really.
When the pandemic hit, one of our main focuses was to support the system flow through the hospitals and ensure that we were still providing the service. At the beginning, we thought this was going to be over in a matter of weeks. We were told you'll be back to work, everything will be absolutely fine. By the time we realised that the cracks were showing and the staff were under tremendous pressure and you were seeing the fear in our staff team's eyes, that has sort of eased now. I've worked in adult social care for the past 15 years. I've worked in care for 20 years. No one saw what was coming. No one understood what was going to happen. And the resilience that the staff team showed, but you could see that the support was going to be needed and it will be there.
I mean, ultimately, this sector relies on people's values and beliefs about giving care, doesn't it? It relies upon people, having almost, for want of a better term, a calling really into this type of work. And I wonder whether people's calling and the sort of like the strength of their identity as being a care provider might prevent them from seeking help when they really need it.
One of the things that we are hearing is that care managers, care workers are starting to feel that they may be at that point of starting to accept that they need some support. And through our various networks up and down the country, we are hearing that some of the wellbeing initiatives, the resources, it's may become a little bit too soon. We hope that this will continue and that as workers get to the point where they feel that they may need that support, then they know where to go. They know where to signpost their staff to, they know what's available in their local area. Our Skills for Care locality managers are really well connected with the local areas. They can get involved and people can find out what's happening through their local wellbeing hub, their care provider association. And I just think it's important to note that, as we know, it's a very varied makeup of social care, and from small organisations to large national organisations who have very different offer of direct support to staff. So some may have access to employee assistance programs, some may have wellbeing advisors, investing in those, but other managers report feeling really quite alone and can feel really isolated. We have registered manager networks across England reaching out to thousands of managers, and managers have told us that these are a real valued source of peer support, advice, information and reassurance, and it can really help managers to feel that real connection with each other, and that sharing, I suppose, when those situations that you're not feeling okay, you're not sure about something, who can you go to get that guidance from?
I've got 50 plus staff underneath me, and during the pandemic, they were all looking to me for the answers. And sometimes I didn't have the answers, and I know that the support were out there, and I know that it's still out there. My management team were fantastic. They were always there in case you needed it. But to go into such a rush lockdown and everything were changing so quickly, the guidance were changing, and we were having to change the way we were working and adapt to the new ways of working in such rapid succession, that I remember being surrounded by a full staff team and answering 200 emails a day. And I'd never felt more terrified or alone in my entire life, because I just didn't know what was happening. And I was trying to support the staff on an individual basis when I were finding staff that were crying in corridors, and because they didn't know, they didn't understand what they were going to be taking home. I was worried for myself. I was worried for my family. I was worried for my staff. I was worried for the customers that we were supporting, that were in the service at the time. So I don't think this could have come at a better time. I know that I've neglected my own mental health, because you're not trying to be a superhero, but you're thinking to yourself, this is my job. I signed up to this. But no one understood what were going to happen or what were actually happening at that time. And you were in a bit of a state of shock, because you were running at a pace that you never thought were going to end. You just did it automatically because you just did. But then when you actually slow down now to a pace where we've adjusted, the service still continues as it is, and we're still providing the service that we've been asked from our colleagues with LTHT. And one of the things that we were wanting to be supportive of was the system flow through the hospitals.
I just wonder how it was for you to be witnessing that sort of stuff within your staff team, to be seeing that emotional reaction to what was going on. How was that for you to kind of see that in your staff team?
It was upsetting, it really was, because these people I've worked with for the past 10 years, and to see a change in them. But I also, on the other side as well, I also saw a lot of different reactions to how things were happening, and some of that were hard to deal with. But it's all dependent on people's fears. I understood that at the time. I could see how terrified people were. I could see how scared people were. No one knew what were happening, and that were the thing at the beginning. And I remember going back to it. I'll never forget it. But it was my birthday, and I was sat there watching Boris Johnson on television, and I'm like, I'm going to have to go into work tomorrow now. I'm not going to be at this. I'm just going to scrub this birthday, and I'm going to have to go into work. And you could see it. You could see it in the staff's eyes. It were like, what's going on? What's going on? And I'm like, as soon as I find out, I will tell you.
Yeah, that uncertainty is so difficult for people to manage, especially when it's something that you could see coming like a tidal wave from afar, couldn't you? And then when it hit, it was kind of dealing with that, really. Juliet, I'm just interested to kind of hear whether any of what Mark's has been talking about resonates with you in terms of what you've seen and what you've witnessed to in some of the people that you've found yourself having conversations with, supporting, etc.
I am a former registered manager, and from my time working in care and support operations, I can't even begin to imagine what the past 18 months have been like for registered managers, for staff, and also with the pressures that they're facing now. And I just wanted to share, we've recently published a little series of videos. There's one of the Wellbeing hubs in Hertfordshire did some collaborative work with one of our registered manager network chairs, and they worked together to give staff an opportunity to have 20 minutes reflective space just to take some time out And Marlene Kelly, who's the registered manager, she said, well, I kind of thought, no one's going to ring, no one's going to pick up the phone. We're just not used to this within social care, free counselling, free offers of support. And, they got together and the staff said, well, yeah, we'll do this, but we don't really think we've got much to talk about. And there was no pressure. It was optional. And it was amazing what did come out. But it was just really interesting that, just to take that bit of time, sometimes, you don't have 20 minutes in a day, never mind having that time to reflect on what's happened. And just to, as Mark, as you mentioned, talking about the fear and the uncertainty and the not knowing and, what was going to happen next. And it just gave them that opportunity. And we are encouraging through our locality managers just to where we can connect those local hubs up and let's spread the word around the support that's available, so that individual support, but also where you can work in groups and working with providers and organisations to look at what's happened within that particular care home or that particular domiciliary service, and the staff will be able to express how it's been for them.
I'm just interested, there's a question coming to my mind, that whether you feel that there are any subsections of staff or volunteers that are the forgotten people, whether there are some groups of staff that you kind of feel like this has had a real impact on them, but actually maybe they're not the first people that people's mind goes to when thinking about, oh, they've really had it tough.
Definitely. I mean, you assume straight away that, we were out there, we were clapping for carers, but without our domestic support, without our chefs, without our maintenance guys, without our gardeners, we wouldn't have had a building to continue to provide a service for the people of Leeds. So that's one of the things that we wanted to shout out about. We wanted to make sure that everyone was included. We work in conjunction with the NHS anyway, so we have NHS staff on site, and we all got the same recognition. But on the back burner, you were thinking, you've got your chef and you've got your general kitchen assistants, that they were providing the meals, they were ensuring that everyone were fed, and they did a marvellous job over the Christmas period. And we, as a hub, we were like the centre of Seacroft. We were a hustle and bustle. There were people coming and going all the time, and then just silence. The occasional customer came in, occasionally we discharged people, but it was just silence from that. It's the people on the other side as well that we need to think about, and hold hands up and say a massive thank you to them as well, because it were clap for carers, it were clap for NHS, but there were also the people that worked in the care homes as well.
Yeah, evident from what you're saying there that there are so many other people that are absolutely essential to the running of services that need recognition as well.
We've had, numerous conversations with managers with homes where there's just significant number of deaths that you just can't comprehend, and just thinking about, the time I've spent working in social care, that you really get to know people so well, people's families, you get to know people's friends, and the loss, and I just can't imagine being able to process that and sort of reflect back over the last 18 months and what's happened. But then there are such a wide variety of different social care providers, smaller providers, and it's not forgetting the PA workforce as well, so personal assistants, those people who employ their own workers, and just ensuring that we're able to reach out as much as possible across the workforce, thinking about, our social workers, our registered nurses within social care, our OTs, and just that the offer is there. And I suppose that what's been going through my head as we've been talking is the challenges and the heartbreak that staff have faced because of the pandemic, but also those wider challenges. So, we're hearing regularly about some, financial challenges, relationships, all the other impacts of home and work and juggling, and that the hubs aren't just there for COVID related, it's there to support you with, what aspects of what's happening within your life. And I think that's an important message to share.
It is so important. And I think that there's lots in the news at the moment, isn't there, about increased pressures because of the financial situation, extra tax coming next year, increased utility bills, and the removal of the top-up universal credit that's been available. And it just feels like it's a really tough time for people who have been really struggling.
I feel that we are literally, this is the tip of the iceberg. Some of my staff team saw me last year more than they saw the grandchildren. I read an article not so long ago about people. I mean, you associate PTSD with massive trauma, don't you? But that may not be the case. Some of our staff, some of us may be suffering with post-traumatic stress disorder from what we went through and what we saw. We've got to open up back to the community. We had when the customers came in, they didn't see the family. They were isolated for 14 days in their own room. We need to start supporting these people to be able to integrate again and build them social skills again, because they might not see anyone apart from doctors and nurses, and then it was just us. And then when they finally could come out into the social areas and the communal spaces and utilize what we had in our service, and it's like, no, I'm just going to go back to my room. We didn't realize how big that this was going to be, that we were going to be needing to be called upon. But we pulled together as a family. We were creative in what we did. So we'd go out and speak to the staff on an individual basis. Come on, do you want to just go get a drink of tea? Let's go have a cup of tea and a couple of biscuits. Are you okay? Is there anything you need us to do? And some of them took us up on it. Some of us were absolutely fine. But you can see, because you've worked with a staff group for so long, that there was something wrong. And just for them, just to be able to relay their fears and their concerns and their worries, and it might be 5-10 minutes, but it helped. And I think that's how we continued as a service for as long as we did, and still do now, is because we pulled together as a family. And I believe that there are so many services out there that have done exactly the same thing. But now is the time to look at if the support is really needed around mental health and any further needs that can be met. I feel that this is what the hubs are going to be doing.
That thing that you said there about PTSD, it is something that the term PTSD, it came from the military. It's something that we associate with Vietnam and other, wars and disasters. And it's not something that we traditionally would associate with our experiences at work within health and social care sector. But I know from being a jobbing clinical psychologist working in staff wellbeing in an acute trust, that people are experiencing trauma reactions, whether it be PTSD or other forms of trauma reaction. And it's also fair to say that what we're tending to find for some people is that their experiences during the pandemic and the things that they've witnessed, the things that they've been involved with, the things that they've had to do has opened up old wounds. This is stuff that people will have had boxed up for years, and then suddenly they're finding that these newer experiences because of the pandemic are bringing that stuff back up. If that's going on for anybody who's listening right now, reach out and seek help. It's not the case that you are broken. It's not the case that you are not coping, that you are not strong enough to deal with this. This is not your fault. This is a normal reaction to something that's really difficult that you've experienced. Going back to the peer support thing though, I'm just really interested to kind of hear whether what you've witnessed in terms of teams coming together and supporting each other, and what your sense of the importance of that is.
The biggest source of peer support that I can talk about is our registered manager network. So these used to be face-to-face networks, people getting together. And obviously then with the pandemic, that changed to developing WhatsApp networks, going virtually, and it just escalated, and with our Facebook group as well, and we're just reaching out to thousands of managers. But it's the feedback that comes through that people describe it as a lifeline. It's giving them strength, it's getting them through, and in those desperate times, just being able to reach out to somebody and to feel that you're not alone. It's just an amazing opportunity to do that. And I suppose from a manager perspective, a lot of the pressures that are coming are system pressures. You've got staff challenges, and you're a bit that funnel as the manager. And what we've we've saying as well is that the manager can carry a lot of this, and it's really important that they're looking after themselves as well as looking after everybody else. You know, we've seen some absolutely amazing wellbeing initiatives, some of the ideas and things that they've been doing to keep staff morale up and to get through this. But a very hands-on chief exec of a domiciliary agency said to me, you know, it's managers shouldn't and couldn't take this all on themselves. You know, she described it as a bit like a moving and handling situation. She said, you know, I don't go and do the assessment myself. I get others involved with the skills and the expertise. And, you know, it's the same with mental health and wellbeing. Know where the support is, encourage staff to use it, share the benefits of that, and protecting managers from taking that responsibility and taking that on themselves.
At the beginning of the pandemic, our staff team were depleted quite a lot as well, because we had a lot that had to be sent home almost instantaneously because they were going into shielding. Now, we did regular wellbeing calls with these staff members, you know, to make sure that they were okay. Now, the normality for me, I mean, obviously everything had changed, the world was a different place, but what kept a sense of my well-being at that time was I got up every day, I made myself a drink, I got in the car and I drove to work and I did my thing and I came home, and I may have occasionally queued outside a supermarket, which I didn't mind doing because it was middle of summer. But then recently I was diagnosed with COVID and I had to isolate in 2 rooms of my own house. And that for me was horrifying. I was pinballing from room to room. Looking at it now, I had staff members that went home at that point and we didn't see them for 3 months. They were isolated, they weren't allowed to go anywhere, and just touching back on unseen staff, and that these are the staff that are probably going to need a hell of amount of support. They weren't there on the front line, but the social isolation that they suffered during that time, how do we combat that as well? And now they've got to rebuild the skills and just to support them back into the workplace, because I know that some staff they felt resentment towards these staff. Obviously, you know, I mean, this was not something that was decided lightly. These staff were taken home and sent home because it was their well-being. They could have died if they caught the virus. The decision was made. There were a lot of things to think about when the services started to reopen and the lockdown started to ease, and these were one of the things that we had to take on board.
I think that there's something really key there about the people who've had to be isolating because of COVID. And I wonder whether for those people that the end of isolation may have well felt like a cliff edge almost. Yeah. It's like, and now you're back. And that I know from conversations that I've had that's been really tough, because the whole messaging around the pandemic, it's been reliant on a message that creates anxiety so that people do the right thing. And so if you've been at home isolating, you've learned to be very fearful of this virus, and maybe rightfully so, but then to be in a situation where, as you say, Mark, coming out of social isolation and having to think about returning to some semblance of normality, incredibly anxiety provoking for those people. And thinking about the relationships, as you said, the relationships that they will have or have been missing or lost at work with their colleagues. What must people think that I've not been at work? How are people going to respond to me? So difficult, so difficult. I'm interested in whether there's any stories, you know, over the last 18 months that have really, you know, sort of like a particular day at work, or, you know, something that happened that you were involved with or that you heard about that still comes up in your mind, that you're reminded of, that kind of resonates with you in a particular way.
We were surfing along and everything were absolutely fine for weeks and weeks and weeks and months. We were doing his thing. We all came into work. We followed the risk assessments that were put in place and all the changes. We did the rounds of customer testing. So we do all the rounds of customer testing, and I'd receive them in an email. And I remember opening the email, and then you get the individual report for the individual customer. usually it says not detected and not detected, not detected, positive, 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 and then we realised that we were in the midst of what essentially was our outbreak of COVID-19 within our care facility, and straight away I blame myself. What have I done? What could we have done better? How has this got in here? So I went outside, I went to the back of the building where there were a little bench, and I just sat there for a minute or two, and I just had a few moments to myself. And then we went in, and then let's get the job done then. So we supported all the customers with making them aware that they were infectious, letting the families know, cohorting these customers. So we isolated onto certain wings to try and stop the movement around the homes. It's a bit bittersweet was that day for me, because for me, I was absolutely mortified about what had happened and the fact that we had an outbreak. No one died from the virus within our care facility, which is still an amazing feat for us, because I know horror stories of so many care facilities that were depleted and the lost residents that have been there for years, and that for me would have been heartbreaking, and I'm sure it's heartbreaking for them themselves and the staff that had to work in that environment as well. The reason it's bittersweet is because I had a meeting with my entire staff team, and they just all pulled together, and they were like, right, we're behind you 100%. What do you want us to do? And that's one of the memories that'll probably stick with me for forever, really. It really will.
Yeah, I mean, so difficult for you, Mark, to kind of be in that position where you kind of seeing that huge change, that sense of responsibility, really, and feeling that and that very human thing where we look to ourselves, what have I done? What could I have done differently? That's really difficult, isn't it? Really nice to kind of hear that your staff team responded as they did. I mean, I wonder whether there were any examples of moments of joy that you managed to have during this time.
We worked with these people and we became so close. We still celebrated Christmas and holidays, and we did together. We had parties, social distance parties to keep together and everything. There was the day when we discharged a customer that was diagnosed in hospital, had COVID, and we did a guard parade outside when we all clapped as she got into the taxi to go home. And there were so many moments to be had, and I'm looking forward to a very prosperous future, continuing to provide a service for the people of Leeds and the surrounding areas.
I think it's just so important to recognise, isn't it, that in times of adversity there can be times of joy as well. And I think that human beings, we have a tendency to sometimes focus on the really challenging stuff, and I don't want to minimise how great the challenges and loss and heartbreak has been over the last 18 months. At the same time, recognising that there's been some joy to be had as well. We're going to start to bring this conversation to a close. So I just wondered whether there were any kind of closing comments or things that you want to communicate to the good folks who will be listening to this podcast.
Mental health is a massive thing that people are really focusing on at the moment, and it's okay not to be okay. I've admitted that. If you feel the need to reach out to anyone, reach out to your peers, reach out to your colleagues, reach out to your friends, reach out to your family. Do not suffer in silence and do not suffer alone, and be aware that the help is definitely out there if anyone needs it, and it's easily called upon.
Everybody's individual experience, their perceptions, their reactions, it's all unique to them, and it's sharing the messages, knowing that the support is available, it's easy to access, it is for everybody, and reaching out when needed. And
from me, just to reiterate some of that, and with a West Yorkshire Harrogate Staff Mental Health and Wellbeing Hub hat on, just to reiterate that message, really, that the Hub is here to support you, whether you are staff, whether you are a volunteer, whether you are a carer, whether you are working as a domestic, as a member of the administration team, wherever you work within the health and care sector, that the Hub's there for you. It's free, it's confidential, and it's been provided by registered professionals who work as part of this system. So I just want to thank you both, Juliet and Mark, for taking the time to talk to me today about the impact of the pandemic and the current situation on people's psychological well-being within your sector. I really appreciate it at the time, so thank you.
Thank you.
Thank you.
You've been listening to We Work Together from West Yorkshire Health and Care Partnership. For more information on the Staff Mental Health and Wellbeing Hub, please visit workforce.wyhpartnership.co.uk. Join us again next time when we'll be joined by more people who work together to improve health and care for people in West Yorkshire.